Thank you very much. Good afternoon, you all. Thank you for joining us for this live demo. So today I'll present to you how to set up a facial treatment, a facial tightening treatment using concepts of micro and macro anatomy, using the unique Liftera that has a digital pulse emission that is actually the only device that has this property on the market. So basically what this digital pulse emission allows us is to have a point of coagulation that has an improved precision, so we are increasing the efficacy of our treatments, but also we are increasing the safety and the comfort for the patient. About the technique that I'm going to describe, it's called InfinitLift, and basically we will use the anatomy of the ligaments to somehow give an improved support to the skin, and in other way to use the microanatomy of the orientation of the fibers of the SMOS and of the retinacum cutis to set up the treatment and to determine the quantity of energy that we need to have a proper result with no downtime and usually a single treatment per year. So let's start with the markings. We have to have in mind several landmarks. White pencil, please. And the first one is the border, the anterior border of the masseter muscle. So we'll fill the border and we will draw it all over this anterior border. The other landmark that we need is the frontotemporal crest that is here, and a parallel line to the ocular retaining ligament. The first line is drawn. Second line, we will draw a line from the upper part of the tragus to the upper part or the upper border of the nasal ala. Last line, we will draw a vertical line from the mid-pupillary line parallel to the masseter 1, and the purpose of this line is to avoid the medial nerve emergencies, to avoid any potential complication. With these markings, we can define several areas of density of energy that we want to apply. We will start for the high density area, that is this one. We will have two medium density areas that will be the temporal area and this medial area, and to finish a low density area that is the infrapalpebral one. Okay? With this philosophy, what we will perform is we will apply more energy, what basically means that we are applying more shots on this area, basically to improve dermal thickness and to give a better facial contour with the skin tightening effect, to have some compactation of this more medial area on the upper part to give a better brow positioning and improve the zygomatic contour, and on this lower density area just to improve the skin quality and improve the dermal thickness. Okay, So for this live demo, I will show you the importance of treating directly this ligament area. We will only apply 1,000 shots with the patented pen and piece of Liftera, and we will compare one side to the other for you to see that with a couple minutes treatment, we can already get a result to show our patient with any discomfort, any pain, and without any downtime. So we'll start applying 300 shots of the 4.5 millimeter depth cartridge over the ligament down here. Afterwards, the 3.0 depth. Up here, 3.0 and 1.5 millimeters depth, 200 shots per depth. Okay. I will guide you through the setup of the machine. Well, we already have the 4.5 millimeter depth pen cartridge, and we will apply 1.2 joules of energy using 10 hertz as a frequency, and as I told you, 300 shots of this depth.
Pedro, hi, Valerie Campos.
Hi, Valeria.
You never use any numbing cream?
No.
Okay. Do you do any preparation for the patient?
Basically, I explain to the patient. Usually, the anesthetic cream only would help with 1.5 and 3.0 millimeters depth. And in the case of Liftera, there is no any pain, zero pain with these both depths. Eventually, with the 4.5 depth cartridge, you can feel some pricking, but the anesthetic doesn't get at this depth, so it's not useful. It has no purpose at all to use anesthetic using Liftera.
Great. And the pain can be a parameter as well, I guess.
Yes, but usually with Liftera, as we don't have any pain with the treatment, we don't. If we have pain, yes, it would be an alarm.
Yeah, exactly, exactly.
I don't have in hundreds patients treated one patient complaining with a significant pain that would make me stop the treatment or raise any alarm. Okay.
Great.
So we will use two different moves, mainly on the bottom part. First, I will apply what we call, and it's patented by Entera, is the moving technique, for us to gently heat the layer that we want, and to decrease the thermal impedance for the shots that we are delivering afterwards. So I'm just spreading the gel, and I will start moving, press, and I'll start firing on circular moves, just 2 passes. And this first part is done. After this, like a Neste movement, first of all, vertical moves and strokes, and afterwards, perpendicular ones.
Pedro, did you have any side effect?
Up to date, just less than 0.7% of mandibular edema when I need to somehow empty the face. So when I need to deliver a greater amount of energy. But we are talking about...
But no scar, just like a transient.
No, just edema.
Oh, okay.
A transient
okay.
edema.
Uh-huh.
We are moving to the 3.0 depth. Okay. So about the energy that we are using, we'll use 0.7 joules, and again 300 shots. The way of doing it is pretty much the same. So first of all, the circular moves to preheat the zone to lower the thermal impedance, and afterwards vertical and transversal strokes.
Do you do yourself or you ask your assistant to do this?
We both do.
Okay.
And basically, this will take just 30 seconds to get done.
The whole face, how long it takes?
Just the ligament lines, we are talking about 7 minutes.
Okay.
A proper done full face in my hands, 1 hour.
Okay.
So now I will keep the 3.0 and piece, selecting 200 shots on the device, and now we will treat this upper part, contouring the ocular retaining ligament and the temporal crest. We have to have a nice wrist movement to assure that we always are perpendicular to the skin. And just doing this, we can immediately see an eyebrow repositioning. Now we will move towards the 1.5 millimeter depth and just treating the upper part. Here we will use 0.5 joules of energy, 200 shots too, and let's go doing the same thing. A little bit more of gel, please.
How frequently do you repeat the treatment, or when do you call the patient after first?
So it depends on the type of treatment. If I see there is an increased sagging in zones that we know that we have an elongation of the retinaculum cutis, such as the pre-jowl, such as if I need to debulk the face to get the face thinner, I reschedule the patient at 6 weeks to give more shots on these areas. If it's just a plain treatment, I schedule the patient at 3 months. That's when we expect the results to get to the stabilization, to the top of the result after the procedure. So I'm applying the 200 shots on the ocular retaining ligament and on the temporal crest. And that will take around 20 seconds. And that's it. Gauzes, please.
Do you have any question for the audience? Yes, please. The microphone is in the middle.
Yeah.
Yeah, I know. You raise your hand, now you have to make a question. I think it would be interesting if you could see both faces, if you could sit for us to appreciate the brown lift.
I will. I'm just cleaning before showing you the difference.
I think if she could sit,
Can you
it would be...
ask her to sit, please?
Yeah. Okay. Yes, we can see it.
We can see.
Yes, it's visible.
Okay, and
Yeah,
if you look, I will ask because light is not uniform. It almost seems that you have some lifting on this zygomatic area when you compare to the other side, because the light flows differently the one side to another.
Yeah, we can see from here. The image is really good.
So
Yes.
you said that this will increase till 3 months.
Yeah.
This is the immediate result.
This is the immediate result, and usually, mainly on the periocular zone, you will have some receding of the results on the 2 first weeks, and afterwards the result will be better at 3 months than the immediate result. The immediate result is not a product of edema, because you don't have enough time for the edema to build up. This is just the effect of collagen shrinking with the coagulation dots that we are delivering at the skin.
Pedro, we do have a question for you.
Okay.
Can you introduce yourself?
Yes, my name is Dr. Nored. I'm from Venezuela, but I live in Madrid. So my question is, how much do you use in the half phase? How many, I don't know how to say, the shots, yes.
Did you understand, Pedro?
It depends, because we need to personalize a treatment properly for each patient. But usually I perform 4.5 lines, 20 in each column. After that, just on the lower part, 800 to 1,000 shots with the pen at the same depth. Moving to the 3.0 from the zygomatic arch below, I perform 110 lines at 3.0 and 1,200 shots with the 3.0. In the temple area, usually no lines here, just around 500 to 600 shots with 3.0 pen, and the same with the 1.5 pen.
It's okay?
Thank you.
Gracias for the...
So I only have a last question. Does that immediately resolve? How long is it gonna last? Is gonna be like that for 3 months, or is gonna? Of course, it's gonna improve in 3 months, but it's gonna last how long? That immediately result. that we can
Especially
see?
like you talk about the brown lift.
How
Can-
long will the results last?
Usually, if you focus just on the brow lift, for maintain the result, I usually like to perform 3 sessions in a row, 4 to 6 weeks apart, and reschedule the patient every 6 months to one single session of maintenance.
How much do you charge?
It depends on the complexity and number of the of shots of the
On
treatment.
an average. For example, this treatment, you just got it.
I wouldn't perform only the ligament line, but the treatment that I just described, usually it's around €900.
Thank you.
You have 1 minute more in case you want to show something special in the machine, or any comment would you like to make?
The comments that I would like to make is mainly that we need to account the anatomy to perform microfocus ultrasound treatments. So, for instance, using 4.5 millimeters depth on the temple area or on empty necks is purposeless, because here we will be firing at the bone, and usually on empty necks, if the platysma is 2.6 to 3 millimeter depth, so using a 4.5 won't give us any result and potentially any serious side effects, so there is no purpose to use it. So study your patients, individualize your treatments, don't forget the anatomy, either the macro, either the micro, and either the individualized one.
Fantastic.
We have
one
one
more
extra-
last question for you.
I just wanted to ask whether real-time visualization of the skin, as you see in some devices, does that help when you're doing the focused ultrasound?
I don't think so. I think that eventually, if you want, you can do some ligament mapping and depth mapping before performing the treatment if you want a proper individualization of the treatment. Just that. Beyond that, eventually, if you want to do an elastography 3 months after to show the improved elasticity and fiber density of the skin, but beyond that, I don't believe there are any other tools, mainly real time, that will help you to improve your results and be safer than this way.
Doesn't the
Thank
real
you
time
so-
doesn't the real time
Just
visualization
very quick, because
Yeah.
we're running out of time.
Does the real time visualization not help you in gauging the depth? Because the skin thickness would vary patient to patient. Doesn't it help in the selecting the transducer?
The transducer that is used usually combined with an ultrasound emitter has not sufficient quality to allow you to have a proper mapping of the skin. I perform on my patients previously to the session using the ultrasound to map the depth, and afterwards I perform the treatment faster than worrying all the time if I'm the correct plane or not.
Thank you. Thank you.